Welcome to More Than Words, a podcast about treating the whole child, brought to you by the Reading and Language Learning Center. I'm your host, Tristan, and today I'm joined by the founder of Cohen Health and Performance, Dr. Zachary Cohen, to discuss physical therapy. Hi, Dr. Cohen. How are you?
I'm great. Appreciate you having me on here today. It's an honor to be part of this. And how are you?
I'm great. We're excited to have you here and really excited to start talking about physical therapy. We haven't had a physical therapist on yet.
All right. Well, pressure's on.
No, not even a bit. But first thing I want you to do is just introduce yourself. Tell us who you are, what you do, where people can find you, all that good stuff.
Yeah, I appreciate you asking. So as you mentioned, my name is Dr. Zachary Cohen, and I'm the owner of a practice called Cohen Health and Performance in Bethesda, Maryland, and soon to be McLean. We're in the process of opening a second location. And our practice is a little unique because we specialize in helping active adults and injured youth athletes and just active people in general. So yeah, we're really excited to be able to share some of that with everybody listening today.
That's awesome. So you said you're in Bethesda, Maryland, and you're opening a new location in McLean, Virginia, which is fantastic. And if people were to go find you online to, come in and see you guys, where would they go?
Fantastic. So our website address is cohenhp.com. That's COHENHP.com. And typically it's really easy to reach out to us that way, find out a little more information about us and that's where all our information is listed. Of course, you can find us on the social medias on Instagram and Facebook and YouTube at Cohen Health and Performance. And we've been posting some cool stuff out there as of late. So feel free to check it out.
Perfect. I'll make sure to link everything in the description, the episode notes, so that people can find you guys.
Oh, thank you so much. That'd be great.
Yeah, of course. All right. Well, let's hop into physical therapy. Let's get a baseline. What in the world is physical therapy, and why would someone need it?
That's a great question, and there's a lot to it. It's funny. It's funny when we will sometimes get patients that come to our practice, and this story just comes to my mind when somebody asks that, and they'll say, "Oh, I tried physical therapy and it didn't work." And my immediate thought is, "Oh, so that means you tried the entire profession, right?" Because it's a huge profession. So when you say what is physical therapy, the definition of it really is pretty vague. It's really the treatment of disease or injury by physical means. So very vague. Doesn't necessarily doesn't say anything very specific, because that sort of gives offshoots to a lot of different specialties. So you can specialize with patients that have orthopedic issues. So your maybe chronic knee pain or low back pain, or maybe a rotator cuff issue in somebody's shoulder that is just, an active person in general that wants to be able to just, move around, go on walks without pain, things like that, all the way to folks that work in hospitals with people that have very, very, very serious, even borderline life-threatening issues that maybe are recovering from cardiac surgery, as an example, or a stroke or something like that. So it runs the gamut from those types of conditions all the way to folks that I know who work with, professional athletes, and then everything in between. So, so it's a very all-encompassing definition if you look it up, I would say.
Right. Wow. So let's start at the beginning of someone coming into your office. If someone needs PT and they pop in and they're like, "Dr. Cohen, help me," what are the first steps you take to get them into the office and start getting physical therapy?
Yeah, that's a great question. So the way we approach it, I will say, is a little unique in the sense that we try to really be mindful of why someone is contacting us in the first place. Because I think why anybody contacts somebody in my field or any related medical field, health, fitness field, whatever the case is they're having some sort of a challenge. And why we make any decision to contact someone isn't usually because of isn't because we want our back pain fixed, or isn't because we want our shoulder issue fixed, or whatever the case might be. It's what that actually means. It's that, oh, my knee pain is preventing me from enjoying my active lifestyle and the things that bring me joy and bring me happiness and help me manage the stress in my life, or whatever those connections are. And so we try to really be mindful of the deeper meaning. And then by doing that, we are able to get an understanding of why this is so important and meaningful to the people that call us. So we want to make sure we really deliver a great experience to everybody calling from the get-go. So if somebody's contacted me, they reach out to me, like you said, what they will do if they typically inquire through our website, or let's say they call our office, is we always make sure to set up a time where they can chat with a member of our physical therapy team beforehand and do like a little mini phone consultation, if you will.
Yeah.
So that they can ask a clinician any questions that they may have, get any of their concerns. Maybe they're a little anxious, get any of that stuff alleviated before they come in, because we want to make sure everybody contacting us feels really good before they show up. So they speak with a therapist for, as long as they need. Usually it's 10, 20 minutes. We may help them schedule their appointment right then and there. Mm-hmm. And then that appointment will be their evaluation. And then we'll explain to them the purpose of that appointment is to discover exactly what's going on, and figure out with them it's a collaborative thing with them, figure out a specific plan of care to get them the best results according with what their goals are. And from there, we then sort of get buy-in to whatever the plan is going to be. And at that first session, let's say we say where they're going to schedule out 5 or 6 visits as an example, we'll then schedule it out right then and there, and sort of hit the ground running from that point moving forward. So it is very custom for each different individual, because one person's issue is going to have probably a different plan than somebody else's.
Right. Wow. That's awesome to hear. So it sounds like it's very personalized. So someone could come in and say, 2 people could come in with knee injuries. They could be very different, and they could have different, deeper meanings for why they're coming in. And you guys really address that. So that's fantastic.
Yeah. No, I appreciate you mentioning that and saying that it is true. It's something, I know it's one of our missions at we call it CHP at Cohen Health and Performance, and is that trying to make not just physical therapy, but healthcare in general a little more personalized, if we can, because one person's, as an example, one person's shoulder issue, even if it's the same structure that might be irritated, let's say, the root cause is probably going to be different from their identical twins, even though they seem like on the surface like the same person. Usually they have different life experiences, different physiology still, despite how similar they are. So the plan that's going to be most essential is going to be different. And if we take a cookie cutter approach and treat every person with a particular diagnosis the same, results may eventually come, but it's going to take a lot longer and might not be as effective.
Right. Wow. Like I said, that's really cool to hear. And I think really important to have individualized plans.
Agreed.
Yeah. So I'm sure you get this question often, which is, how long do things normally take? And after talking about what we just talked about, it sounds like this isn't going to be a standard answer.
Yes. As there's a lot of our patients always get frustrated when myself and our staff say this, but we always believe that the right medical answer in most cases is it depends. Right. There's so much nuance. There's so much complexity to medicine. I think that's my belief and my theory as to why they say we're always practicing medicine. We never actually master it. We're always practicing, because there's so many factors that impact why somebody's feeling the way they are, right? And everybody has so many life experiences. There's so many internal influences. I mean, the world nowadays is so, there's so much going on that it can impact things. And so with that being said, we always want to give some sort of a ballpark. So that ballpark might be 5 to 8 visits, let's say, because we can still give some nuance where somebody, I shouldn't say nuance, I should say some specificity where if somebody has an acute ankle sprain, let's say they sprained their ankle a couple of weeks ago, they want some insight from us. And, we can say, knowing the research and knowing what has happened when we see this before, it's probably good. We may only need 3 to 5 visits.
Okay.
But if somebody's coming with a 3 to 5 year history of lower back pain, okay, that could be, we're looking at minimum probably 5 visits, most likely closer to 10.
Yeah.
Because we know the longer something's been going on, generally the longer it takes to go away too. So you can give some people a ballpark as well. And usually at least we'll get a patient started with saying, well, we know we're going to at least need this much. So let's start off with a plan of this many sessions. And then we'll almost reevaluate when we get to that point because we'll know a lot more.
Okay. So next thing, someone comes in for their, I don't know, let's give an example, their shoulder problem. And they've never been to physical therapy before. They have no friends that have ever been to physical therapy. They have no experience. And they're like, what are you going to do with this? Like, what happens when someone comes in? Like, do you move their shoulder? What happens?
Yeah, it's a great question. And that is a question we get a lot because it's still in the grand scheme of things, the physical therapy profession is still more or less kind of new. Yeah. Compared to other healthcare professions. So there's a lot of unknowns still. So, with that being said, whenever anybody contacts us and asks those questions, a lot of times I may joke and say, I don't know, because we're gonna figure that out when we see you. But I'll tell them like, okay, so what we're gonna do is when you come in, we're gonna have a bunch of questions for you. So I'm gonna ask you a series of questions to find out more about what's happening and why. And then we're going to do a few tests. Those tests, if it's a shoulder issue, as an example, those tests will involve us seeing how much mobility, how much range of motion you have, the ability for your shoulder maybe to move. And if any of that's painful, that will then give us more information to make further decisions. We'll see what strength you have in there, and we'll do a few quote unquote special tests that will tell us if there's any maybe structural things we need to worry about, if maybe there's a tissue that might be irritated we need to be mindful of. And then, of course, we're going to do some similar assessments with neighboring areas, knowing that what's surrounding joints or regions of the body that are close by will have an impact on what your shoulder in that case might be doing. So we're going to find out get a lot of this different information, and based on that, then we'll determine if we need to what hands-on drills or hands-on techniques we may need to implement, whether it's stretching or massage type techniques, or maybe if we need to give you exercises to address perhaps the root cause as to what may have led to all of this. And a lot of times it's going to be something within those realms, and usually a mixture of all of them. So we'll kind of go through all of that, and then of course let the person know. But at the end of the day, we're always going to want to eventually have it be solutions where we don't have to put our hands on you at the very end. Because if on your very last session you're still requiring us to do a lot of things that you can't do yourself, then you're not obviously ready to be sort of graduated, because you're still depending on us or something. We want to make sure at the end it transitions to the point where now it's all exercise based, because you can replicate that on your own and then become independent. And ultimately our job is to help you overcome pain, overcome injury, and teach you the things you need to do to be able to prevent this from becoming an issue again in the future.
Okay. So it sounds like there might be things you have to do outside of the clinic. Am I correct? In between your visits?
Yeah. And I would say that's probably a very unique thing about our profession, and something we really double down on at our practice at Cohen Health and Performance, because we actually don't see people typically as frequently as maybe other physical therapy clinics, because we usually dedicate a little bit more individualized time per patient per visit. Okay. So we spend a lot of that time educating and teaching them about the origins of of their injury, and specifically walking them through what they need to do independently to be able to address it, so that they also are in good shape when they leave, like I mentioned before. And ultimately, even if a patient came to and saw us 2 to 3 times a week, which would be very much on the higher end of frequency,
Right.
And they spent a whole hour with us each time, which again, I don't think we have a patient who does that at this point, but let's say they did. That would be 2 to 3 hours a week out of 24 hours times 7. So still, in proportion, they're not seeing us very, very often relative to the amount of time they're not seeing us. So no matter what they're doing outside is going to have more of an impact than what they're doing inside. So ultimately, we have to give them things they can do on their own. And if we're really trying to develop new habits or teach maybe we get somebody to improve the way somebody moves so they're not putting stress on a particular tissue, let's say, then they need to learn some of these things. And learning a new way to move or a new habit or new anything requires repetition. So if we really are concerned with our patients' benefits, and we really want them to ultimately be able to sort of leave the nest, so to speak, then we have to give them a lot of strategies they can do on their own. Otherwise, we're just kind of promoting way too much dependence on us.
Right. So for parents who have kids that are in physical therapy, what do they need to do outside of the clinic to kind of help their kid along, especially with the exercises we just talked about, but just in general, what can parents do to kind of help them out?
Yeah, that's a fantastic question. And I wish parents asked me that more often, to be totally honest. But because it is a team approach at that point, because obviously the parents are highly involved, and a lot of it will depend on the age of the child, of course. If the child is on the younger side, let's say younger than 15, I would say, then the parents, I would say, would have to be more involved. Obviously, it's dependent on each individual child's maybe emotional maturity levels and those kinds of things. Maybe once they're 17, 18, getting ready to go to college, they're probably going to be able to be independent. And we see a lot of parents want them to learn that independence at that stage, so they kind of take a hands-off approach, which I totally understand. But I will say, if it's getting younger than that, it's really important for parents to be involved, specifically because a lot of kids just need that accountability, to know, like, okay, well, Dr. So-and-so said that you need to be doing your home exercise program once a day, every day. Have you done it today? And just have that reminder, that kind of, did you do your homework kind of thing?
Right.
And so that's one thing. The other is, especially on that first session, I think it's really important for parents to be there and specifically be present to hear some of the explanations and hear the assessment that we will often provide to their child, and ideally to them, so that they can also, in addition to their child, gain an understanding as to, why this injury occurred in the first place. Because oftentimes we'll, in our field, it's very easy to just say, okay, why did this injury happen? Like, oh, okay, my shoulder got hurt. Okay, what do I need to do to fix it? Or as opposed to thinking a little deeper and saying, well, why did this happen in the first place? And that's the things that I want parents and the children to understand, so that ideally they can prevent it from happening again, because the reoccurrence rates in our profession are just frankly too high. So I would say for parents, it's definitely being present at that initial visit for sure, and really asking good questions. Really don't be afraid to intervene and so that you can gain an understanding of what's going on. And when therapists send home programs to their kids to do at home, make sure you're included on that, so you see what's going on and that you understand the reason for every exercise that's being given. I'm very much a fan of being challenged. I think that's okay. I'm okay if a parent wants to challenge me and ask me, hey, why did you give, Johnny this exercise to do at home?
Right.
Because asking those questions show that they care, and they care to understand. And we know when people understand, they're more likely to do it. And that's ultimately what we want. And frankly, it's a good way to determine you're being given just a protocol that every patient with a shoulder injury is given, or if there's actually a deeper thought process behind every piece of this. Right. So those are the couple things that really popped in my mind.
Yeah. Okay. That's good to hear. So definitely being involved from the get-go is what we can take away from that.
Absolutely.
And I remember you mentioning at the very beginning of that it's a team effort. So included in that team, do you work with the coaches and trainers and doctors with like specific clients?
Yeah, absolutely. And I think if a clinician really wants to get the best results for their patients, I think in any profession, you have to not just be open to, but be eager to collaborate with other professionals. And ideally everybody that's in that patient's network, because anybody that person's working with or communicating with is going to have an impact on the outcomes that they're trying to achieve. So in our case, we know that we're just one part of this team, and that we need to make sure that we value the other people that they're working with, because what they're seeing and their opinions matter. It doesn't matter whether what title they have, whether they're a surgeon or a trainer or whomever, or their coach. We want to make sure that we're all on the same page, because oftentimes we can work together to all move in the same direction. I think that's so important. And in the example of even like a coach, for instance, which on surface may seem weird for a physical therapist and somebody's soccer coach to communicate it as an example. But we know from a lot of research that when an athlete, let's say a high school athlete or middle school athlete, if they get injured, they're more likely to experience a re-injury if they're forced to be off the field longer. So we may often see that, we're going to keep them out longer to be safe. Where if we can perhaps challenge that thought and say, are there things we can do to keep that person active within the restraints of their injury? Then their long-term outcomes might be better. They'll be less deconditioned. Their tissues will be more ready to handle the stress of play, let's say, and it will be the transition will be less drastic, let's say. So, and obviously, somebody, tore their ACL, right? We're not going to say, hey, well, the research says this, you should be, no, we understand it's with those caveats. But if somebody has like say a hamstring injury, like they pull their hamstring, well, we know that their long-term outcomes are better if we return them to just running protocols within reason earlier rather than later. Again, they're going to return to the field quicker. So, so those are things we definitely try to be mindful of as well.
Wow, that's so interesting. My husband, he actually played basketball for a really long time, throughout middle, high school, and college. And he had a hand injury, which obviously it was in a cast. So he was out for a while, but he had other like more minor injuries. So I'm so interested to ask him if, he got back into playing more quickly, because I didn't realize that was something, it makes sense, right? I didn't realize that was something that physical therapists did.
Yeah, absolutely. And because a lot of what we do as well doesn't necessarily have to be these crazy, fancy, awesome techniques that only we can do.
Right.
Sometimes it's just being able to be that guide and that coach in some ways in our own right, to understand the science, understand how tissues adapt, for example, and be able to guide people along the way in that sense. So in the case of like your husband, for example, and injuries he may have suffered as part of being an athlete, it's important to understand on our end that there's a very, very foundational principle called progressive overload, where tissues respond really well to stress because they need stress to adapt. Just like the example is, if we're trying to build muscles as an example. Well, if I want to build a bigger muscle, I need to add stress to it via training in the gym to cause it to then have to adjust accordingly and remodel to get bigger and handle that stress next time.
Right.
But there's a little bit of a happy medium where if I go too far and add too much stress, then I set ourselves back, increase the risk of injury, those kinds of things. So you have to be able to, in a way, know how much stress to dose to a tissue so that it gets enough to facilitate an adaptation, but not so much that it can lead to an injury. And that's the same as coming off an injury when we return to play, because you'll see it even if you watch professional athletes on TV, if you really pay attention, you'll notice that the majority of them suffer their soft tissue injuries. Let's say they strain a calf or a hamstring or something like that, as they're returning usually from something more serious. Let's say they're coming off an ACL injury. Well, the hamstring injuries and little tweaks here and there tend to come as they're trying to transition onto the field, because maybe we're not totally as dialed in with that sort of not too hot, not too cold, area in between as we as we progress to the field. So yeah, it's definitely an important concept. And again, there's a lot of gray area in there. So there's room to play, which is the fun part.
Right. Well, it sounds like part of getting back on the field, per se, as you're still recovering from an injury, has a mental portion to it as well. So what changes do you see in clients with like their confidence, and kind of their overall happiness when they are injured and they start to go through rehab and even after?
Oh, that's an awesome question. And that's at the end of the day, why I think we do it, right? It's ultimately to make the impact on what is important to them, as I mentioned earlier, because like I mentioned, when somebody calls, like nobody cares that their back hurts. Right. Like I got into this field because of a back injury I had as a collegiate athlete. I didn't really care that my back hurt. It was that my identity was very wrapped up in being this, active, vibrant collegiate athlete, and my identity was being impacted. And when I eventually was able to overcome this injury, it was I was feeling better about myself. I was feeling more confident. I was just more engaged in life. I wanted to, I cared more. It's almost like I cared more about school, like things that seemed unrelated. And so 100%, it's that's the impact I think that these physical issues can have mentally, is it can impact confidence. It can impact how you view yourself, and how you view yourself interacting with the world. And on the flip side, right, that's the opportunity that we have as clinicians to impact others. And so that's such an important part of it. And frankly, we know that we even are starting to see some research on this, that sort of mentality side of things is often going to be a greater predictor of outcomes in rehab than a lot of the more classic things we might otherwise spend more time focusing on.
Wow.
So it's a pretty cool rabbit hole that we're going to get a chance to go on as the research evolves.
Right. Wow. That's very cool. And would you say that is why you love being a PT?
Yeah, 100%. I think I love it because also of as I mentioned earlier, because of the complexity of it as well. Understanding that there are so many things that impact our health and our wellness, which can sometimes seem overwhelming, but also is exciting because it means that there are so many opportunities to help somebody, so, and it's also understanding that we don't need to be perfect. And I think with the advent of social media and other things out there, we sometimes see all these things we quote unquote should do, but understanding that, we don't necessarily always need to be perfect. We don't need, if it's okay if, maybe our diet's not as dialed in one day, or we don't sleep the perfect amount one night, because there's a lot of areas we can work on to just try to improve 1%. That's it. Just make a 1% improvement. I think that's one of the things I love, is being able to help people in so many different ways. Of course, with the classic things people come to physical therapy for, of course, being able to help them with their injury, with any pain or discomfort, or things like that they might be experiencing, but also being able to maybe help them in other ways they didn't expect, and ultimately with the end goal of positively impacting what makes them happy. And that's really why it's just a medium to do that. And that's what gets me excited.
Wow, that's awesome. Oh, it sounds like such a fun field to work in, to just help people through whatever it is they're going through. Especially, like I said, I think what you started with, which is that you have such a personalized level of care for each client that you see. I think that is so important. And it does sound like it's what makes everything kind of worthwhile.
Absolutely. It's very much a relationship, I will say, like a lot of ways. Like it's not healthcare. It can't be just, a clinician calling the shots and being like sort of like the parental figure, if you will.
Right.
And just, in this, you as the patient following orders. It's very much it has to be two equals talking to each other, developing a relationship and a dynamic, because ultimately where our job as clinicians is to work with the patient to help them reach what's important to them. And it's not up to us to determine what's important. It's up to the patient to determine what's important to them. And then our job is to work with them to help them get there, and then be able to adjust with whatever maybe their restraints might be. And yeah, so it's very much a relationship. And that's the other fun part of it, is you get a chance to really get to know a lot of people. And that's part of the excitement for me is developing relationships is always a fun part of this.
Yeah, that's awesome. Well, I think that's all my questions for you. If you have anything else you want to add at the end here, feel free.
Yeah, I appreciate it. I don't have too much else. I mean, your questions were fantastic. And I guess the only other thing I will add is that everything, that I was able to share is what's even more cool, what's even cooler about it, I should say, not more cool, cooler about it is that now is that we get to, as business owners in this profession as well, grow all the impact of everything I shared by bringing on amazing people that also share those same values and find those same things important. And in some cases may even be better at doing many of the things that I shared than I am, which I am very happy to say that many of our team are. And it's so it's exciting, because then we get to just impact so much more of the community, and hopefully that can continue to level up our profession as a whole.
Yeah. Oh, that's awesome. Well, thank you so much for being here. Like I said, having a physical therapist on is so great. As with this podcast, we look at the whole child. So it's good to get another lens in here. So thank you so much for being here.
Oh, thank you so much for having me. This is a pleasure. And, it's just great to connect and collaborate with other awesome people. So I appreciate it.
Of course. And thank you to the audience. Don't forget to subscribe and give us a little rating and review so you guys know when we release new episodes, and we'll catch you next time.